Most people think GLP-1 medications are just weight loss drugs, but in medicine, we see them differently. We see them as heart protection medications that also cause weight loss. And today, I will show you why drugs like Ozempic, Mounjaro, Wegovy, and Zepbound are some of the most powerful tools we have to protect your heart. Let's break it down simple, clear, with no medical jargon. First, we need to understand why heart gets damaged in the first place. Well, heart disease doesn't come out from nowhere. It comes from 5 main problems. Number 1 is high blood sugar. Number 2 is high inflammation. Number 3 is high blood pressure. Number 4 is excess belly fat. And number 5 is abnormal cholesterol metabolism. GLP-1 medications target all 5 at the same time. That's why cardiologists are excited about them. Now, let's go step by step and see exactly how they protect your heart. Number 1 is blood sugar protection. Well, high blood sugar damages blood vessels like acid on metal. GLP-1 medications come to the rescue and reduce sugar gently, reduce insulin spikes, and prevent sugar from staying in the blood. Less sugar damage, less damage to the arteries, healthier arteries, meaning fewer heart attacks. This alone is massive heart protection. But heart disease is not just about sugar. It's also about inflammation. So how GLP-1 control inflammation? Well, heart attack happens when plaque becomes inflamed and unstable. So GLP-1 medications lower inflammatory markers, stabilize artery plaque, and reduce clot formation. Less inflammation, less plaque rupture, meaning fewer heart attacks and strokes. Now, let's talk about fat, the most dangerous one, the belly fat, or as known as visceral fat. Well, belly fat is not cosmetic. It is hormonal. It releases chemicals and inflammatory markers that raise blood sugar, raise blood pressure, and increase inflammation. GLP-1 medications target this fat first. So when belly fat shrinks, the heart becomes safer. Now, let's talk about the first thing that my patients notice when they start GLP-1 medications, which is blood pressure improvement. Many people see lower blood pressure even before major weight loss. So less pressure means less strain on the heart, less damage to the blood vessel or less shearing effect on the blood vessels, and longer heart life. It's like removing weight from a machine that has been overworked. So what about cholesterol and triglycerides? Well, GLP-1 medication, they lower triglycerides. They often raise HDL and they make cholesterol less inflammatory. Even when LDL doesn't change much, plaque becomes more stable and less dangerous. Here, what we're going to talk about next, which is something unique about GLP-1, which is direct heart muscle benefits. GLP-1 medications improve heart efficiency, improve energy use, and support heart recovery. That's why they are being studied in heart failure patients. Now, the most important part. GLP-1 medications reduce real heart events. This is not theory, this is data. Large trials show GLP-1 medications reduce heart attacks, strokes, and cardiovascular events, and death. These are life-saving drugs. So when people say GLP-1 are just weight loss medications, I will say no, it is not. They are heart medications that happen to cause weight loss. They treat sugar, they treat fat, they treat inflammation, they treat blood pressure, and they treat cholesterol metabolism. All in one. But here's the thing, they are not magic. They are not magic. They work best when you take care of other things, like proper sleep, proper exercise, proper protein intake, and stress control. They amplify your effort, but they don't replace it. So here's the thing, who could consider them? Well, people will benefit more if they are obese, pre-diabetic, patients with type 2 diabetes, patients with metabolic syndrome, patients with strong family history of heart disease and stroke, and patients with high heart risk. These people gain heart protection, not just weight loss. And here's the truth. Your heart doesn't care how you lose weight. It cares about sugar is low, inflammation is low, fat is reduced, and blood pressure is controlled. GLP-1 medications deliver all of that. So no, they are not shortcuts. Again, I want to stress on that. GLP-1s are not shortcuts. They are precision medicine. Your heart responds to biology, and GLP-1 medications speak biology fluently. This is Dr. Nony from Dr. Nony's Power Lab. Protect your metabolism and your heart will follow. Thank you for listening. Have a great day. See you later. Bye-bye.